Lassa fever is real and we need to be on alert. According to the Nigeria Center for Disease Control and Prevention Lassa fever situation report for AP Week 7 ranging from 12th to 18 February 2024, out of 507 suspected cases of Lassa fever, the number of confirmed cases stand at 66, with 13 confirmed dead, affecting 13 states and 32 local government areas in Nigeria. These cases were reported in Edo, Ondo, Kogi, Ebonyi, Bauchi, Cross River, Taraba, Enugu, Imo, Delta, Niger, and Yobe states. But in all of these, the Nigeria Center for Disease Control and Prevention and other relevant stakeholders are working assiduously to address this outbreak. And you may ask, what is Lassa fever? How does it spread? How does it come about? And how can one stay protected? All of these questions will be answered in this episode.
92.3 Sparkling FM.
Hello, Ukamaka-Richard is my name, and welcome to another educating episode of Your Health, Your World on Sparkling 92.3 FM, Calabar. Before we answer some of these questions, I went into the street of Calabar to ask people what they know about Lassa fever, and these are some of their responses. Do take a listen. Do you know about Lassa fever?
Yes, I do.
What do you know about it?
It's a fever that is gotten from rats. So maybe when you eat something that rats has pee in or defecate in, then you get the fever.
So how do you keep your things safe from contamination from rats?
Put them in an airtight container and always clean also.
No, I don't know.
You've never heard about Lassa fever?
I've heard of it before.
And you don't know what it is?
Yes, ma'am.
It's malaria.
Have you heard about Lassa fever?
Yes, I've heard about Lassa fever.
What do you know about it?
I don't really know, but I only know about the symptoms. The symptoms will come like malaria symptoms. That's how maybe Lassa fever comes.
Since you think it comes like malaria, what do you think causes Lassa fever?
Like dirty places and playing with pets and eating bush meat. That's what I think.
92.3 Sparkling FM.
Welcome back. You see, some people know what Lassa fever is, but others do not. And it's so important so you know what Lassa fever is, you know how it spreads, you know what causes Lassa fever, and most importantly, you know how to stay protected. And like I said in this episode, all of these questions will be answered. So stick around, let's go play this song, and when we return, we'll be talking with our guest for today. Enjoy.
It's the one thing that can make the world okay. And it doesn't cost nothing, no, you don't even have to pay. Oh. It's about doing the right thing every day. 'Cause you are the light, you are the sign, you are the only hope, keeping hope alive. Do the right thing, let the world see, let the light shine everywhere. And when it seems like no one's watching, do the right thing anywhere. Just do the right thing all the time, and you'll be sure to have the whole world saying yeah.
92.3 Sparkling FM.
Welcome back, and thank you so much for listening to the song. This is still Your Health, Your World on Sparkling 92.3 FM Calabar. Ukamaka-Richard is my name. The song you just listened to, Do the Right Thing, is the central message for today's episode. Let's do the right thing. Let's unite against Lassa fever. And our guest is already available to talk to us on what to do to ensure that we stay protected against Lassa fever. Our guest today is Dr. Yetunde Abioye. She is the Incident Manager for Lassa fever at the Nigeria Center for Disease Control and Prevention. Please listen and get out your paper and your pen and pay attention. And at the end of the day, assure us that you will do the right thing to stay safe. If you have any question in the course of this conversation, remember to drop it on the WhatsApp number 0812-723-7060 or 009-230-0022.
92.3 Sparkling FM.
All right, so can we meet you?
Yes, so my name is Dr. Yetunde Abioye. I'm a senior veterinary officer with the Nigerian Centers for Disease Control and Prevention. I'm an epidemiologist and I support primarily One Health activities. And I'm also the incident manager for Lassa fever.
Okay, so now talking about Lassa fever, what exactly is Lassa fever? Because we've been hearing about Lassa fever, but a lot of people really do not know what Lassa fever is. So can you just give us a little bit of an insight into what Lassa fever is?
So Lassa fever is a viral hemorrhagic fever, and most of the time it presents acute. So when we say acute, it's a situation whereby you have cases being following infection with the virus itself. You have people coming down with cases within 0 to 48 hours, or sometimes up to 36 hours. That's like 3 days, right? That's why it's called, and causes acute viral hemorrhagic fever. So it's a virus. I don't know if it's really important to talk about the type of virus, but it's caused by an old world arena virus, and it's been in the country or since it was isolated from 2 missionary nurses in 1969. It was also named after the town in Lassa town in Borno State. So it's causes just like the other viral hemorrhagic fevers that you know, like Ebola, causes bleeding from multiple orifices. It's associated with different signs. It can mimic malaria and even dengue and so many other types of fevers, but specifically it also presents symptoms like viral hemorrhage for like Ebola, and the symptoms can come in, in severe cases you have the patients coming down with acute kidney failure. So usually cases that don't have adequate access to proper healthcare, like facilities with dialysis machines and all of that, can actually fall ill. So we manage cases with ribavirin, but there's no treatment actually. So ribavirin is just an antiviral drug that are used to manage better outcomes for the disease. Yeah.
Okay, so what exactly causes Lassa fever, and how does it spread? Does it spread from person to person, so that we have like a clearer understanding of how we're supposed to live our lives, knowing that this disease is around?
Yes. So Lassa fever is endemic in Nigeria, and not just Nigeria alone, in West Africa, but Nigeria bears the highest burden, although it's mainly because we report most of the cases within the region as well. So it might be in other countries, but they might not be aware. So right from, I think, the early days, especially in the 70s, when a lot of research went to following the infection with the missionary nurses, the Mastomys rat, which is the common African rat, was found to actually be to carry this virus. Even some of them are chronically infected from birth with the virus itself, and then about 30% of that population of the rats also carry the virus. But we've also found out recently that, so that other rodents can also carry. So the common rats that you see can carry. And that's why we're having the situation we have in Kaduna, because it was not a case of an imported case. The index case was in an accommodation within the, military base, and then all of that happened. So it's beginning to tell us that a lot is happening even upward north, rather than what we see downward. And the types of rats as well are also different, but then it also shows that these other rats can also carry this virus. Now, most recently, I know I said recently before, but most recently, we have a paper as well that has shown other reservoirs that are not rodents. So you have lizards, you have cattle, you're having dogs, so it's going to show that there is a lot of multi-hosts playing in this transmission of Lassa fever, and it begins to make us become worried, because now the span of the outbreak will be increasing, even though we record confirmed cases every month of the year, but we have a spike within the dry seasons from October to May. It's also beginning to make us question the role of these other reservoirs in transmitting Lassa to humans. And then Lassa fever is also, or the virus itself, it's very well adapted in the sense that, in the past, you have sporadic cases of Lassa. So before 2016, confirmed cases were not more than 100. You have 50 to 100. But now we are recording 1,000 plus. Like last year, we had a lot of cases and over 200 deaths, which is so unfortunate, right? And even now, you can already see the number of cases we have is already over 100. Even some states alone are already having that bulk of 50 cases, which we used to see before in just nationally being recorded. So it's really a cause for concern. Other rodents, other reservoirs are available. And then the virus is very stable. So following a spillover of this infection, usually we say the infection starts from, contact with these wild animals. And then lizards, they can go anywhere. Yeah. Rats can go anywhere too. So then, of course, you have your domestic animals as well. Sometimes you even go for hunting with your dogs. Yes. And then now they are also showing that they have seropositivity for Lassa. It's a cause for concern. So once there's a spillover from wild animals to humans, there is sustained human-to-human infection. And that's why it's very easy for you to see, especially in the healthcare setting. When we talk about the Kaduna case again, there was a case in the community, the person presented to the hospital, healthcare workers were exposed, and before you know, another healthcare worker infected another healthcare worker. And even
that means it's transferable from person to person, not just animal to human.
Yes. So there's usually you might not know, you might not know which source. Is it through contaminated food, water, or even just touching a surface through the the urine and all of that of the rat or whatever. Or it's not just rats that are implicated in this, right? Other rodents or other animals as well. So that happens. And then the person becomes infected, goes to the hospital, can infect, of course, other people around.
So has it, just sorry to cut you, so
yes.
Has it been, because you had mentioned that now they do not know how the person got infected. So
but
is it by physical touch? Is it by maybe their fluid? What exactly is, how exactly does it spread?
So it's different ways, because some people even consume rats. Yeah. So maybe even in the preparation, even in the true consumption, it can happen. Mm-hmm. Some people, it's that, okay, maybe they didn't cover their food properly. Or like, for example, you have a yam now, rats go and eat pea. They pee and then they poo. And then the person might be like, okay, this yam is very expensive. Maybe let me do this. Not knowing that it's already infected. And in that process of cutting with your knife, you then, so a lot of things could happen, right? Yeah. So there are multiple routes of transmission, but usually it's through contacts with these reservoirs in the wild. Either they come to your house or you encroach into their place. And then once a human is affected, because the virus is very stable in humans, it's a well-adapted zoonotic disease. Then you get cases of now the person taking care of is exposed, can also come down with the disease. The healthcare workers who might not be suspecting Lassa when they go to the healthcare facility can then be exposed. Usually they are the ones most at risk. And then if this healthcare worker then meets other healthcare workers or other patients in the hospital, they can also transmit this virus or the disease in the healthcare settings facility itself. So you see that risk communication should not just be targeted even at the healthcare workers. Of course, for them most especially, because it's an occupational hazard. That's what they do. They take care of sick people, right? But for us, even as people in the community, we need to also make sure that we always practice our hand hygiene practices. Of course, in the hospital, you say infection prevention and control, but something as simple as hand washing, making sure you prepare your food well, cover your food properly, avoid contacts with, just don't put food where, all these lizards or rats will looking for.
Access to
yes, practice proper, for me, I would say don't even burn bushes. But when you do that, after harvesting, there are some crumbs, like, if you harvest corn or if you harvest granite, some will fall down and the rats can feed on this. But once this is burnt, then they start looking for food when it's the dry season. But rainy season, you hardly see them come close. So it's once in a while you see that contact whereby a person doesn't know how they got the infection. Maybe might have contacted from somebody, or most likely contacted it from a rodent or a wild animal, and then from that they become infected and might infect a healthcare worker. But during the dry seasons, they are looking for food, and then we also, in a way, are also encroaching into their space. Look at the population explosion, climate change, and all of that. They are basically looking for food, and they can come into your space. But it's a really kind of very interesting dynamic. I know the one for the rats have been well documented, but there's a paper now with other novel hosts as well, and it's a really big cause for concern. And even our risk communication efforts need to be geared towards this. Of course, we need a robust research because it was done in a few states, but then I'm sure more evidence will come over time.
So talking about your risk communication, would you say you record more cases of Lassa fever in the rural areas or in the urban communities? And also, if it is in the rural communities, what are the efforts that are being made to ensure that they are aware that there is even something like Lassa fever and how to prevent it or keep themselves safe from it?
Yeah, so actually I will agree there is a lot of gaps when it comes to risk communication. Lassa fever has been around for 55 years and counting now. But then we still need a lot of community engagement, and it's kind of mixed. So of course we have high burden LGAs. I actually don't have any, I would have just told, I know Owo is in town. Is in town, so it's a developed place. So you keep wondering, why are we having this case here? I mean, we even have a federal medical center there in Owo, but you still see a lot of cases coming from there. So it's more of like poor implementation of your environmental sanitation and hygiene. You have issues with where people, for them, it's a delicacy to eat rats. Just like somebody comes to tell you, don't eat chicken. So, but you tell them, apply caution. It's not even about the type of rats, because before people say, oh, you can eat other rats, but don't eat multimammate rats. These other rats can carry the virus as well. You know, it's kind of, you kind of see that there's quite a lot. Like, for example, I don't want to mention, but even in a particular state, people, once they just tell them it's Lassa fever, they believe it's a death sentence, or they would rather just go home and die. They don't stay. So we have issues where people discharge themselves against medical advice. They leave against medical advice. So they abscond from treatment. Even though the drugs and the tests for Lassa fever is free, there are other things. You will need to hospitalize the person, might need dialysis, might need oxygen, depending on the organs or whatever that is affected. And some of these facilities don't have dialysis machine, they don't have histochemistry machine, so it's kind of just early presentation. We encourage early presentation to the healthcare facility, but a lot of people do self-medication. I'm having a headache, let me go and buy malaria.
So how does one identify what exactly is the first symptoms? What are the first signs that they would see for them to know that, okay, this is likely, Lassa fever?
So like I said, like before, Lassa fever can present with multiple symptoms. The person can be having fever. The person can just be having fever, just present like have abdominal discomfort, and it might just be Lassa. So most of the time, which is unfortunate, our healthcare system is not really robust like that, but I'm happy at least the government's trying to see how they can help the primary healthcare centers and all of that. But most of the time when people have an illness, all of that, they just, okay, maybe it's malaria, because we're endemic for malaria. I mean, now we are seeing issues of dengue in Sokoto as well, even though thankfully it's a localized outbreak. But speaking about Lassa fever again, people can just have symptoms that are very similar to malaria or typhoid, and once they take medication, they see it's not going, it might be Lassa. But then you cannot advise them to self-medicate. In fact, you can't even get the medication for Lassa fever in any, you can only go to those treatment centers that have it through the state team. That's where you can get treated. But most of the time, people don't go to the hospital or go to lab to check. Even, it's not all laboratories that can test for Lassa fever as well. We have designated laboratories. So we will advise people, once they start having symptoms like malaria, or they are having fever and they've been treated and it's not going, please subject yourself to the healthcare facility. Oh, this is that. You might not know where it is coming from, but as a person, and since we know that we are endemic for Lassa fever in Nigeria, you can actually ask them, please, can you also, do you think it's Lassa? Maybe, if you're reading online, following the news, exactly, for it. There's no harm in doing that. And then if it's not Lassa, you know that, okay. But at the worst stages or acute stages, in fact, the infection can just be within 24 to 48 hours or 36 hours, that's 3 days. And then they begin to show those extreme signs like bleeding. Well, unfortunately, sometimes we even have pregnant women that also have these issues. So it's really sad and worrisome that we've had this for long and we're still battling with it. And even now we're having more cases. Before, we would just say, oh, it's in the south. But now we are seeing the issue of Kaduna and even other states in the north.
So I think it's important to note that Lassa fever is not a death sentence, because maybe for some people they might think that if you have Lassa fever, this is the end of it. So yes. Lassa fever has a cure.
Yes. So Lassa fever is managed. Like once you have early presentation, like I said, there is no specific cure like a drug that you can say you took and then this will remove the virus. So they treat symptomatically. Ribavirin, which is an antiviral drug, is one of those drugs. Very expensive, but we're happy to get partners that support to get these drugs to all our treatment centers or through the state's Ministry of Health to help keep these drugs against this kind of seasons and other PPEs. But it's not a death sentence. That's for sure. Once we have a case and the person presents early to the facility and they are managed quickly, with ribavirin and other medications. If they need dialysis, the hospital can do dialysis for them, like if they have a dialysis equipment and all of that.
But
or they can even refer them to where they can get this proper treatment if that treatment center doesn't have. But most of our treatment centers have this equipment, and we also have partners that will also help with this, hopefully very soon in the future.
Is there a point where the person would have gotten to in the Lassa fever illness and, there's no treatment that can actually cure the person? Because now some of the people who are listening to this might also be people who have gone past the early stages of, the illness, and they've gotten to the point where they don't know what's going on anymore. So is there that point where they can get to and the treatment will not do them much good?
So I'll still advise again, please present to the healthcare facility early, especially when you start taking drugs for malaria or you've been treating typhoid and it's not going. Please present early to the facility. Tell them whether you've heard about Lassa fever. Can they also run a test for this? Just a suggestion for it. We're not praying for people to get to that end stage where it's almost irreversible, where the case is very bad, because that's what happens most of the time, and then unfortunately they die. They arrive the hospital and they die within, you understand? So we're not praying for that. We are really hoping that you present early to the facility. And I think it's difficult. We can't play the place of God at this point in time and say, once you start having bleeding, forget about it. No, I don't believe so. I'm sure there are people that have had those signs, but they've still come out on top. And I also believe that everyone's immune system is different. It will surprise you to know that some people even get infected and don't even know. They don't even come down with this disease. But in severe cases, that's where we are talking about issues like this, because our metabolism and our immune systems basically are very, very different with regards to Lassa fever. Some people can react badly. Some might not even show sign. They might just have headache. After a while, it goes. So, but the earlier, the better you present to the healthcare facility, especially after treating fever or malaria or typhoid, and it's not going. The next thing you need to be aware of, because we're in a Lassa fever endemic country.
I would just also want to ask, they say prevention is better than cure. What are some of the measures that, people can take to prevent Lassa fever? How can they practice the right kind of hygiene, in order to ensure that they do not fall victim to this illness?
Yes. So please, we actually advise that people consume rats with caution at this point in time. This is a high Lassa fever transmission season. We also advise that you clean your environments properly, cover your food, even your drinking water or source of drinking water. Like some people might have a tank and it's open. If rats go and drink in there, you'll be wondering, where did I get Lassa? It's part of the transmission. They could urinate there and they could also poo there, and that can be an avenue. Yes, prepare your food properly, cover your food. Don't buy garri that is dried on the road. I know sometimes it might be difficult not to even know that, but that's actually a very big hazard as well. Not just garri, but any other thing that is dried on the road. Could be maize, and it's packed for a while.
So does that mean everybody should make their own garri or something?
Yeah, so you see, that's what I'm saying. It's very difficult, right? But as much as possible, of course, we want the people people processing this food to also be cautious, right? There are also issues where we've had this rice bran factory, where you see that sometimes, when the rice millers, they can prepare, in the process of processing those husks of the rice. Sometimes the rats go there and they eat it, they pee and wee, and sometimes you find these hawkers coming down with it. So professions like this is also very important to practice good hygiene, and whatever, or call them offals, they can use it to feed animals as well. Let it be stored properly where rodents don't have access to this. If they, as much as possible, prevent burning bushes, because that's when you invite the rats into your home when they cannot see food to eat. Then buy your food from very good stores, with good NAFDAC number and all of that. I know it's a bit difficult. You cannot even know, because even the person selling it to you did not prepare it. He went to buy it in the market. But so please prepare your food. Yes, wash your hand as much as possible. Clean your houses. Cook your food well. I know Nigerians, we do that a lot. But then also, when you visit an endemic area, to be cautious of what you eat. Very, very important.
Okay. So finally, I'd just like to ask you to just elaborate more on the dimensions of Lassa fever preparedness in Nigeria. How prepared are we for this particular disease? As regards awareness, as regards risk communication, how prepared exactly are we in Nigeria?
I would say that we are doing well, but we need to do more. And unfortunately, the outbreaks are beginning to also spread beyond where we know, because those places like Edo, Ondo, they've kind of built capacity because of the outbreak over the years. So we also need other states to also like when they are trained, to also utilize this training, to not be running away from treating viral hemorrhagic fevers. Can be managed once you wear your appropriate PPEs. Our major concern also is healthcare workers, because the Japa syndrome is real, not just among them, but every other profession. But then we need these ones that have decided they are not going anywhere to be alive and well. So it will be important for them to also train themselves, but also adhere to this training. Because I remember there was a question asked about IPC, and they're like, we're talking IPC since Ebola, before Ebola, we're talking IPC now. People will always be human beings. It's a positive behavioral change you have to cultivate. So it's very, very key. We've done a lot. We have a medical countermeasures. So we have Ribavirin in stock. We'll still get more, of course. We have the testing kit. The test for Lassa fever is free. We have that. We have our laboratory networks. We're expanding laboratory networks. We did an after-action review of the last outbreak. We did a webinar series on Lassa fever to get us ready in the States to act, that's why we activated our EOC early, our Emergency Operations Center, on the 12th of January. I know, funding can be an issue, especially we need states to take ownership of their response efforts. Then we also need to air more jingles, radios and plays in local languages. We also need to most hospitals don't have dialysis machines. Some of them, the major problem is they might even have the dialysis machine, but they don't have water, pipe-borne water. So electricity, pipe-borne water. So these are non-systemic issues. But the ones that we as individuals can control, it's very important. We need to conduct advocacy to state governments, partners, CMDs of teaching hospitals, for them to be at high alert, and not only that, provide required resources. So, during COVID, there were a lot of, everybody was, this social distancing, we're using hand sanitizers, we were wearing nose masks, we're kind of adhering to these things. But the moment COVID, a lot of things COVID, I know those places where you go now and wash your hand when you are in a hotel or all those places now, you don't find hand sanitizers there again. You don't find soap. Some, if you're lucky, you see water, right? So we just need to, as a country, we just need to make sure that we sustain the efforts from COVID, even now for Lassa and so many other diseases that we have, so that we can be able to eliminate them or control and manage them as much as possible. The national goal at the moment is to have a less than 10% case fatality. But even less than 10%, that means people are still going to die. So if you can do that, achieve the less than 10%, and even set another one of nobody should die from Lassa fever. Yes, there are plans for vaccines, but this will take a while. They are still doing vaccine trials. And then after that, even when they bring it, the acceptability, would people really also accept it, or they will feel that, people have come again. People have sentiments around vaccinations. So we need to start early engagement on that as well for vaccine drive. We need to also make sure that we get local governments involved as all state actors, partner with private and public partnerships, very important, so that we can at least, because these outbreaks are not occurring at the capital, they are occurring in communities. They're not occurring, some are in the state capital, but some are occurring in certain LGAs. And it's very, very important. We've also had cases of where we are having intrastate transmission. So the mother died here. Unfortunately, the two children are also confirmed Lassa positive, and the father has moved them to another place for treatment. So you see, the driver is at risk. The clinician, if he's not being told what happened, is also at risk. And before you know, an outbreak can start again. So containing them early is very, very important. Since we know we are in the high transmission season, we need to make sure that we do all that we can. All hands need to be on deck. Let's get our chiefs, our governors, our commissioners of health. Let the state and federal government also do. Healthcare workers also need to be provided with the right PPEs to be able to protect themselves. So if it's issue of generator, electricity, whatever it is that they will need, it's beyond just me protecting myself. And then for our food processors too, please also process this food, whether it's gari or rice or whatever, using the right equipment and technology in line with the NAFDAC regulations for food safety. It's very important. That way you protect yourselves, your family members, and we, the consumers that will buy your product, from coming down with Lassa fever. I think these are very key information. So it will require an all of community, all of society approach. It's not just for me to sit down in Abuja here or wherever I am, making policies and trying to develop guidelines. If the CMD of a hospital or the IPC focal person or even the staff in the hospital does not do what they are supposed to do, it's going to affect. If our community heads and leaders are trying to hide some certain things, oh no, people sometimes, unfortunately, even stigmatize these people that become cured. We need to also change that perception. Then sometimes as well, people don't present early because they feel it's witchcraft. If a man maybe dies and 3 of his wife, they'll say, it's village people. Sometimes it might not be village people. It's just present early to the healthcare facility. I've heard about Lassa. I hope it's not, or they can run that as part of the test and start you on treatment treatment early to make sure that, you don't lose yourself or any of your loved ones. And to our healthcare workers, we really love you, especially for those of you that are still in country. We know the Japa syndrome is real. It's not just in the healthcare sector, but it's really, really felt there because we know our population is rapidly growing and we have fewer doctors every day. Please protect yourself. Stay alive for your loved ones, your family, and also for the society at large. Thank you so much.
92.3 Sparkling FM.
Thank you very much, Dr. Yetunde Abioye, and thank you, Uchenna, for conducting this interview. Now, the central message is that all hands must be on deck to tackle Lassa fever. We must put in place the right preventive measures to ensure that we are protected. And to our healthcare workers, please protect yourself, stay alive for your loved ones. And to the government, please ensure that we have all we need in place to stay protected. And to you out there, please do the needful. Lassa fever is not witchcraft. Lassa fever is not a death sentence. All you need to do is to adhere to what you've listened to today. And this is where we draw the curtain on today's episode of Your Health, Your World on Sparkling 92.3 FM Calabar. Ukamaka-Richard Bassi is my name. Many thanks to everyone who contributed in making this episode a success. I will see you again next week, Saturday, same time, same station. Until then, please stay safe. Bye for now.